Welcome to the Genesis Healthcare Podcast, where we go beyond the traditional office visit to explore what it truly means to live with optimal health. Each episode brings you candid conversations with our Genesis providers and featured guests from across the health and wellness space, covering everything from primary care and prevention to aesthetics and lifestyle optimization. Whether you're ready to take control of your health through a Genesis membership or explore treatment options to look and feel your best, we're here to guide you every step of the way. Ready to begin your journey to better? Visit thegenesisdifference.com to schedule your first appointment or aesthetic consult today.
All right. Well, I want to introduce Dan Pohlgeers to the Genesis podcast. Thank you for coming by and having a sit down with us. So I'd like to first say welcome, and then I'd like to say introduce yourself to us and what are you doing?
Sure. I'm Dan Pohlgeers. I've been in healthcare for 36 years. I've lived here in this area for 31 years. I started out as an occupational therapist and became a certified hand therapist, went back, got my MBA, went into practice management, did practice management for a little while, and then I started my own consulting business called Sunesis Medical to help independent physicians stay independent. And whatever model,
I like that.
Whatever model they chose to do, had some experience doing helping folks opt out of Medicare and Medicaid, and going to like a DPC type of practice. I've also had experience with specialists who have made the decision to opt out of Medicare and Medicaid, but continue with some commercial insurances, and also have worked with physician groups that want to have more traditional practices, but have difficulty with contracting, regulatory, CMS issues. So I've kind of become an expert on all of those things through my experience doing all those different types of practices. Also have had a lot of experience working with advocacy type of things, right. Especially at the General Assembly, with making sure that there's no pieces of legislation coming down the pike that actually are harmful or hurt the practice of medicine, and have been doing that probably for about 15 years, kind of as a side part of my business.
Just making sure that you're down in Nashville in the legislature.
In the legislature.
Is that why you're now throwing your hat in the ring for the Senate?
Well, most definitely. Because I do see some statewide issues going on with things like downcoding, and insurance companies are just trying to run over independent practice and practice in general, not just independents, but also hospital-based practices. Sure. But then also more specifically on my Senate run, which is August 6th, the primary is August 6th, more so about that than just what's been happening up here in Upper East Tennessee. For the last 10 years, I've been one of the biggest critics of the merger that created our monopoly healthcare system, acute care hospital healthcare system here in Upper East Tennessee. I'm one of the few people that attended every public hearing prior to the COPA, the terms of certification of the COPA being agreed upon. And each one of those is still out there on public domain. You can see those on YouTube, where I was talking about what happens with vertical integration and when two large healthcare systems combine to become one and become a monopoly, and some of the adverse things that occur, like decreased quality, increased cost. You usually have problems with not only employment retention, nursing shortages, those types of things, allied health professional shortages, but you also start to have problems with physician retention. And I think all those things have come true. And I feel like 10 years, almost 10 years into that, 8 years into that, it's time for us to do whatever we can to build an environment here that is welcoming to competition in this market. Because competition, restoring competition in acute care hospital market here will actually even make Ballot Health better.
Right.
They will become a better healthcare system with competition
And that gives us access
and
to,
improved access.
as
Improved
patients
access.
and as providers.
Right. And oftentimes what happens when you have that type of vertical integration or just monopolies in general, I mean, I think it's pretty simple economics. It's kind of economics 101. When you have a monopoly like this, you start to see the organization pulling services out of peripheral areas and bringing them back, kind of what's called a spoke and hub model. And so all of a sudden you have these rural hospitals that at one time had diagnostic imaging and surgery and acute care beds. They start pulling that stuff out and bringing it back to a central hub. And then all of a sudden you have folks in rural counties that aren't able to access the care close to home where they live. They're traveling 35, 40 minutes.
So let me ask you, with that right there, what, I'm in Washington County, and
Right.
a lot of the voters are going to be in Washington County.
Sure.
And so we kind of look at that as, well, that doesn't really affect me because I don't live in Johnson County, or I don't live in Southwest Virginia where all of those services have been taken away. And so how does that affect me as a Washington County?
Well, it does, because it affects you in capacity. So does Johnson City Medical Center, who is having issues with keeping nurses. They're having issues with keeping beds open in the hospital. All of a sudden, Carter County is a great example. When you have a hospital in Carter County that had an ICU, and the health system decides to start diverting patients away from that ICU to Johnson City, and that ICU goes away, as it did 2 years ago or 3 years ago, all of a sudden you stop having the capacity at Johnson City Medical Center to pull all those emergent care cases into your hospital. So at one point in time, and this is well documented too, EMS in Carter County was complaining because they're pulling folks from Butler and up near Mountain City and into Johnson County. They're pulling those folks to what used to be the hospital in Carter County, Sycamore Shoals.
Sure.
And now all of a sudden they're being diverted because there's no ICU. Yeah. And Johnson City Medical Center doesn't have the capacity to take those ICU patients. So they're now being forced to take folks to Bristol Regional Medical Center. And so that's where the problem occurs. And
so that's the collateral damage.
Collateral damage. And also, that's, again, well documented with Watauga Orthopedics. And there's certain cases, certain total joint cases that need to be done in an acute care hospital that has an ICU. Somebody who's obese, grossly obese, or has heart issues or cardiac issues, or has diabetes, patients that are at risk and need a level of care that requires a hospital with an ICU to do those cases. And so you live here in Washington County and you fit that mold of those patients that need an acute care stay. And now Johnson City Medical Center, because of the capacity issue with trauma care, you all of a sudden move to the back of the list, and there's no guarantee that you're even going to have your case done that day, depending on the level of trauma that's happening. And so those physicians now have to take you to Holston Valley, even though you live in Washington County, for that quote unquote elective case that may require ICU stay.
So it does affect us in Washington County.
Definitely affects us in Washington County. You didn't have those types of things when you had two health systems, because again, even with all things equal, like Medicare reimbursement is equal across the board. When you have all things equal, you still have to make sure that you're maintaining a certain quality level to make sure that you're enticing patients to your hospital.
Not to mention iron sharpening iron.
And iron sharpening iron. And so, the best thing that can happen, and the General Assembly did do something this year. I wish they would have done it effective 2027, but they did it effective 2028 for our area, is doing away with certificate of need. So we're setting the groundwork. They've already started to set the groundwork to allow a competing hospital system to move into this area. But that doesn't necessarily happen overnight. Okay, so I think people need to understand that even though there was a lot of celebrating about CON going away, there's still a lot of work to be done. The Health Facilities Commission, which is kind of directly tied to Senate Health, still is going to have to do licensing and approval. And we also need to make sure that we don't start to have a system in our government in Nashville that licensing takes the place of certificate of need. And we have seen that a little bit even with the certificate of need law. The certificate of need law had a clause in there that if you were a freestanding emergency department or you were a freestanding cardiac cath lab, you had to be affiliated with a hospital. And it's that word affiliated that's so important. That word affiliated means owned, managed, or partially owned by a hospital system. And right now we only have one hospital system. Now they did come back and make a carve out for the only cardiac cath lab in Tennessee that's privately owned, Caring Hearts here in Washington County. Thank goodness that was caught and that carve out was done. But in my mind, that clause shifts certificate of need from certificate of need to licensure. That should have never even been in that law. If you're a hospital and CMS is, from what I understand, reading some of the CMS regulations, Centers for Medicare and Medicaid, a federal government agency that oversees and regulates those types of things. Things I'm reading is they're considering expanding the mileage set point for a freestanding emergency department, because there are actually now emergency departments that are kind of hybrid emergency departments. Right. They have CT scans, they have X-ray, they have a short stay observation beds in them. And because the Centers for Medicare and Medicaid, the Trump administration, the Department of Justice understands that we need to do something to improve access to emergent care in rural counties and rural parts of the country, not just Tennessee, they're allowing these freestanding emergency departments to be affiliated with hospitals. Right now, I believe it's 50 miles. The state of Tennessee says 35, I think, off the top of my head. But CMS is thinking about expanding that to 150 miles.
Which is important for Montana.
Yeah, and right. Theoretically, it could be important for here too.
Oh yeah, across the state of Tennessee for sure.
It could help us. It could help us with that whole idea of bringing additional competition to this market with a freestanding emergency department,
which a lot of people don't even realize. I mean, that's an ICU too.
Yeah,
the emergency department.
Yeah,
that's where a lot of our ICU patients have to stay, waiting on a bed upstairs.
Waiting for a bed in the ICU department, mm-hmm. Getting back to that access issue.
Access, yeah. And that's where I think the people of Washington County really need to understand that the impact is really on our access to our hospital locally, that is being affected. We've got patients being transported here from Southwest Virginia, and we can't get into our own hospital if we have something emergent or urgent,
right?
That has to take place. So
yeah, and I think one of the reasons why I think it's really important, Senator Crow has been in the state Senate now for 36 years. That's a long time, 1990, and think about where you were in 1990. Probably just
Science Hill.
Yeah, Science Hill. I think you told me you were 18 years old, so you could actually vote.
Yep.
But you know what? If you're less than 52 years old today, you aren't able to vote for Senator Crow when he ran the first time. And so that in and of itself, I think, is problematic.
Right.
I think it's important, and I certainly have done this even to a much smaller extent. Organizations that I've belonged to, organizations that I've volunteered and had leadership roles in, after 7 or 8 years, 10 years, it's important for the vitality of that organization that you get new leadership.
Right.
You get fresh ideas, you get a fresh perspective, and so I think 36 years is problematic in and of itself. He's not had a primary opponent in 20 years, which again I think is really kind of alarming. But when you throw on top of that on his all of the documentation that we have to submit to the state when you run for office, your letter of intent, where does your personal funding sources come from? When he lists the hospital monopoly as his primary funding source for his income, I think it creates a little bit of a conflict. At least in my mind, it creates a little bit of a conflict. And so if you're looking at the fact that he is the chairman of Senate Health right now, and remember we talked about the Health Facilities Commission that oversees the licensing and the regulatory stuff of hospitals and ambulatory surgery centers and all those things that required licenses in the state of Tennessee, is he going to be motivated to do everything possible to have competition move into this market when he's working for the current monopoly? And I do.
That's tough.
And I do believe that that's problematic. And I think the last 8 years, and this is something that I sometimes say to folks in my stump speeches, depending on the crowd, think to yourself, is healthcare better now than it was 8 years ago? Is healthcare in our
here.
Okay.
It is here at Genesis.
Outside of Genesis Health, is healthcare in Upper East Tennessee, especially in acute care hospitals, is healthcare better? 8 years ago, we heard stories that made us cringe about quality and access problems, waiting in the emergency room for 5-6 hours before you receive care. Conditions inside the hospital not being ideal. We heard those, but we heard them from what I refer to as my brother's cousin's uncle twice removed.
Sure.
Okay. 8, 9 step, hearsay. But now, 8 years into this, I think the overwhelming majority of people in Washington County have a firsthand experience with some of those issues. Either somebody in their immediate family, or someone that they go to church with,
Right.
or someone that they work with, or friends with. First-hand experience, and I think that's disappointing. Certainly wasn't that way when I moved here 31 years ago. I moved from the Charlotte area. I was working in outpatient as an outpatient therapist, primarily in orthopedics. When I moved here. And I was actually recruited by Johnson City Medical Center to help start their hand therapy program when it was just Johnson City Medical Center, prior to Mountain States Health Alliance. I was very, very pleased with the quality of care that you were able to receive in Upper East Tennessee. This was homecoming from my wife. My wife is from Bristol.
All right.
So it was wonderful for her to come back here. And it was wonderful for our family to have raised 2 kids here. I have 2 grandkids here in Upper East Tennessee. And most importantly, my wife was here and I was here to support my wife and assist my wife with the care of her aging parents. And they both recently passed away in their 90s. And so would never trade that experience in my life, and I'm so glad that we were here and that we made the decision to come here. What I'm not happy about is how there has been a decline in the quality of our healthcare.
Can you speak a little bit about the vertical integration and those guys actually discussing that are in the healthcare system over here, saying we had to do these things because insurance carriers are not paying well, and therefore we've got to get a better pay system. Can you go through their side of the story
Sure.
and kind of rebut or talk about why that is such an issue for them?
Yeah, and there's a white paper that's circulating on the internet right now through Facebook and social media, and it actually addresses some of these things. Our payer mix is not unlike the rest of the state, as we've been partially led to believe. Medicare reimbursement is the same across the state. Now, hospitals and hospital systems can negotiate rates on Medicare Advantage and pay for performance and pay for quality, and they can also with commercial payers. I think some of the things that are happening, and I would toss this out to your viewers. People like you and I who have the means and the resources are probably not going to have an inpatient stay here locally. If I had a medical urgency or emergency, because of my connections with the type of work that I do, I can be anywhere in the Southeast within 4 hours and get expert medical care. Now, I would choose not to do that if I could find it here and have an acute care overnight hospitalization here and not be worried about some of the things that the star ratings are showing us about our local hospital system. And there's a lot of people that are doing that. And so I think a lot of those people who have good insurance and are on commercial insurance or have the means to travel are leaving our area to do that. That's sad for the 95% of the people that don't have those means and services. And those are the people that I feel like I'm running for also. So that's part of that question. The other part of that question is, I think when you have a hospital that's in a rural part of Upper East Tennessee, and you've stripped all services out of that hospital, it's easy to come back and say, well, that hospital doesn't make any money. Especially when you stripped all the services that would be making that hospital money.
Right.
And so I think that happens also. Also, that same white paper that's circulating out there actually goes and looks at population health metrics that are put out by the Centers for Disease Control, the CDC. And it looks at population health along the Appalachian chain from here all the way to Morgantown, West Virginia. And people here are actually better as far as health goes than they are in those places like that. Their population health is significantly less. Their rate of smoking, their rate of obesity, their rate of diabetes is significantly higher than what ours are. Yet their hospital systems seem to be outperforming our hospitals. Not 100%.
That's the lack of the whole truth, huh? That's the lack of the whole truth.
That's the lack of the whole truth. So I think hospital systems do have those challenges, but everybody has those challenges.
Sure.
Every healthcare provider has those challenges, whether you're a hospital or an independent practitioner, or you're working for a corporation. You're going to have those issues with battles with insurance companies, and one of the things that I think the General Assembly worked on this year that they were not able to get past was an issue called downcoding and prior authorizations. Right now, and I work with practices that have this issue, both those issues actually. You have a specialist and somebody that does procedures in their office that you have to have prior authorization for, and you get the permission from the insurance company to do that procedure or that service to the patient. But the prior authorization comes back to your office and says this is not a guarantee of payment. So how does that work? How does that work? And then they're at times systematically just denying claims. And so there's a cost involved every time a medical practice has to appeal a claim. The medical group Management Association probably 10 years ago put a price on that, because operationally, you're paying somebody to do that. There's a charge every time you file a claim electronically with your clearinghouse that manages all that stuff. And so the number they put on it was about $26. So the insurance companies per claim. So the insurance companies know that if they deny, delay, don't pay, that there's a certain percentage of those claims that will never be processed.
Which is why I had to do what I had to do here at Genesis.
Right.
We had to go to a direct pay plan because we couldn't sustain it. Right. And we didn't have the manpower or the financial manpower to fight it.
Yeah.
So,
and so a lot of small practices, even specialists, make that decision to opt out of Medicare and Medicaid because the system has been set up so much that all of a sudden, if you're a large practice, you can have an entire department that does nothing but manages your claims processing, or pay someone a lot of money to do your revenue cycle management. But I think the smaller practices who want to stay small and want to be able to deliver a certain type of care to their patients have figured out, like you did, that it's just not sustainable.
Right.
And then you throw into something else that's called down coding, and we can get in the weeds a little bit here, but basically CMS, Centers for Medicare and Medicaid, set up what an E&M code is. That's when you go to see the doctor for a regular visit or for a new patient visit, and it's based on time. And so if the physician spends X amount of time with you, it's what's called a level 3. And if they spend a little bit more time with you and they're talking about more disease process issues or other things that are going on with you, it might be a level 4. And those are based on the amount of time that the physician stays with you or the provider spends with you. And so what happens is the provider bills that level 4, and they file their claim, they get reimbursement, and the insurance company decides that they have not met that level of specificity, is exactly what it says. And they pay a level 3, which is a lower charge. Now, 5-10 years ago, the insurance companies would deny the entire claim. The provider would have to appeal it, send in the documentation that proves that they did a level 4, and then the insurance company would pay it. They're not even doing that anymore. They're just making a random decision that there's no way that you did a level 4 without any documentation, without any objective information, and deciding that you only get a level 3.
And it's just because.
And it's just because. No rhyme or reason.
Yeah.
No rhyme or reason. And there's, for people that are on our side of that equation, and I think hospitals are probably looking at this too, because this is happening to hospital-based physicians. Sure. Also. Hospitals are kind of looking at it, and you're trying to figure out what's the algorithm. How are they making this decision to do this? And I think AI probably has a lot to do with it.
Right.
Yeah,
that's unfortunate. Well, can you talk a little bit about Dan and really, like, what can I do to make an impact in the Senate when I get there?
Yeah, I think that even in Tennessee, special interests have a lot of control over the Senate, and the General Assembly in general. And I think there needs to be a little bit of a shakeup on that. There's organizations there that are spending hundreds of millions of dollars, millions and millions of dollars, on lobbying. And I often wonder, am I gonna go and be in the Senate, and am I gonna represent special interest, or am I gonna represent the people of the 3 counties that are in District 3, Washington, Carter, and Johnson counties? And for those folks, especially those folks in Carter and Johnson County, how often do you see your current General Assembly members? How often do you see your current senator in your communities? How accessible is he to you? I'm going to be present. I'm going to be accessible. And some of these things that we're talking about now, I think a lot of it's being generated by big pharma and big insurance and big hospital associations.
Right.
They're driving a lot of the stuff and that's happening in the state of Tennessee. And I want to be one voice of many. And I'm hoping to build alliances. Dan Pohlgeers can't do this by himself, nor do I think I can do it by myself, nor am I smart enough to do it by myself. To build alliances not only with the other folks that live up here that are in the General Assembly, but also General Assembly members across the state to show them that there's a difference. I have a really, really strong healthcare background. And so I'm already, engaged with members of the General Assembly to assist them when pieces of legislation come up that they don't understand. The flip side of that is for those things that I'm not as well versed at, I'm going to have to depend on those General Assembly members for that and the people in these communities to help educate me. But I can promise you, even on issues like education and agriculture, I'm not going to let a lobbyist who comes into my office who has never worked a day in a school system or has never worked a day on a farm tell me what's best for the people in Washington, Carter, and Johnson counties.
Well, I can appreciate that.
So I think that's going to be the biggest difference. Mm-hmm. My presence, my desire to build a network of people that live in these areas that have a vested interest and need to understand exactly how what happens in Nashville can affect their day-to-day lives much more so than what happens in Washington, D.C.
Yeah. Well, I think that's a noble undertaking.
We'll see if we can do it.
Well, we're going to do this, and I'm excited to have competition. Even I discuss competition even in a direct primary care standpoint. I make mention to several people, like, if you don't want to go see somebody here at Genesis, go to somebody that does have a direct primary care or a direct care or private pay option, because they're going to give you a little bit better opportunity of time. We have the opportunity to give you time. We listen a little. We can listen a little longer,
right?
Because we don't have to jump through all of the hoops of government legislation or insurance legislation or taking back our money.
Right.
And people think that anytime you're in medicine, there's a money tree outside. Money does make the gears of this practice work, and that's the cooperative that we have with our patients. Is They pay us, we give them health and wellness and a piece of our mind, and sometimes a piece of something else. So, but it's a great opportunity to say I do welcome competition. I welcome them sharpening me, making me better.
Right.
And so I don't want people to think that I don't like the current health system as an entity. I want them to be a great entity. I want us to have that opportunity to have what we had when we grew up here in Washington County and Unicoi and Carter and the hospitals that I worked at in the past and even in Kingsport. And so, I know you and I talked to Dr. Jack Williams about that, who was my mentor in medicine, and he just, he took me under his wings, and we went to all these local hospitals and rural hospitals, and we saw patients, and just was a fantastic opportunity for me to understand people in different regions, and they're just right over the hill.
Right.
And it was just fantastic to see the opportunity that a young man could get in medicine and see these doctors that actually were in charge of their patients and were happy and took great care of their patients. And I think right now we still have the same heart to take care of them. We just don't have the same opportunities.
Right.
Right. And I think a lot of that is truly, mandated.
Yeah. And we also
time in a room.
and we also need to make sure that nothing changes in Nashville as far as your ability to do that.
Right.
Regulatory types of things can happen, and there's unintended consequences to any piece of legislation.
Right.
And so you really need somebody that has a working fundamental knowledge of what's going on. Part of that, even though that's a small part of my overall business, going to Nashville and reading legislation, all of that is a learned skill that I've picked up from being there. And I've had a couple voluntary appointments for the Work Comp Advisory Council and for the local COPA Advisory Council. And those experiences have taught me that there's legislation is often passed that does have unintended consequences. If we can make sure that when we're looking at a piece of legislation that we can minimize that as much as possible, it's going to be better for everybody. Kind of like catching the clause that would have eliminated carrying hearts. Right. I was the one that caught that. I contacted Dr. Schoondyke. I contacted Highlands Physicians Incorporated, who I also do work for, to let them know that this was not a good piece of legislation because of that clause, and that we needed to do at least the minimum of making sure that we protected that ASC from closure, and let's give credit where credit's due. We have two members of the House in the General Assembly, Representative Tim Hicks and Representative Gary Hicks, really kind of came to the rescue and assisted with making sure that there was an amendment that carved out carrying hearts. Now, would it have been better if we would have just completely carved out that whole section? In my mind, yes, but we needed to do something because the legislation, it was kind of like the train had left the station, and it was already traveling 1,000 miles an hour, and we needed to do something that was at least the bare minimum.
Well, thank God for your heart. Thank God for your abilities.
Yeah.
And I really appreciate what you're doing.
Well, thank you.
I appreciate you taking the cup, even from me.
Well, it was not an easy decision, and it was one of those things where my wife and I prayed a lot about it, and we kept it very close to us. We didn't tell a whole lot of people. We didn't want all the static and all the drama that's involved with that stuff until we actually made the final decision. And I tell you what, even the day that I made the final decision, it was still tough. Sure. I've known Rusty Crowe for 21 years. When I picked up my papers, my petition to run against him, I walked out to my car, and the very first person I called was Rusty, because I wanted him to know. Rusty knows how I feel about the COPA. Rusty knows how I feel about the legislation that was passed to allow the monopoly. So I don't think that was a surprise, but I think it was a surprise to him that I was going to make this decision, because it does come with some sacrifices, and sacrifice that I'm willing to make, because at this age, I feel like I also need to make sure I'm giving back to the community that has welcomed me, and this is home. I will die here. Good Lord willing.
Hopefully after the session or two.
Hopefully after a session or two. But I mean, it's at 60. I'm certainly not going to be there for 36 years. No. But probably 8 or 12. And then again, it'll be time to maybe pass the baton to somebody else. Who will then pick it up and run with it to get those fresh ideas and to have a different perspective. Because and I do tell people this every once in a while, because every once in a while somebody will tell me they disagree with one or two things that I stand for, usually minor stuff, and I look at them and I just kind of very sheepishly or very coyly say, you let me know when you find a politician that you agree with 100%.
Okay.
I just don't think it's possible. And you and I are not going to agree 100% on everything. We might agree on almost everything, but we're not going to agree 100% on everything. My wife and I don't agree on everything.
Right.
And we've been married for 35 years. We can all agree without being, or disagree without being disagreeable.
Right.
And I think that's a very important aspect that sometimes gets missed in politics today also, is that you feel like you got to bury somebody just because they think that healthcare should be done a certain way.
Right.
So
the divisiveness is truly demonic, and I can't. It's like
Yeah.
we can agree to disagree. We can hammer out details, and it's okay. I love having conversation with people that disagree with me.
Yeah. Iron sharpens iron.
Right, and I love to get better.
Yeah.
For myself, for my peers, for my patients, for the community. I like to hear different viewpoints.
Yeah.
I don't agree with them.
That's what makes the world go around, man.
But if everybody agreed with me, it would be really bad.
Maybe.
So, but I really do appreciate that. I think we do have some PACs that are set up to support you for donations, and we can pop those things up on the screen.
And my
give that to
website.
'em.
Yeah, I encourage everybody to go to my website. There's a lot of information on there. There's commercials that we're going to be running on that website also. So it's Dan, the number 4 tnsenate.com, and certainly would appreciate people's direct support too.
Right. Well, I'm grateful that you're willing to serve.
Yeah.
My wife is extremely grateful that you're willing to serve. Thank you, buddy.
Thank you.
Thanks for tuning in to the Genesis Healthcare Podcast, empowering you to live optimally. Ready to take the next step? Visit thegenesisdifference.com today to learn more.